There was a cost done by the Joint Fiscal Office for the new healthcare board. That was done. But examining what the whole system might cost was not done. So Wendy Wilton took it upon herself to begin a process of trying to figure out what this new healthcare system for Vermont might cost. And this is what she's come up with. The Joint Fiscal Office has not done this.
They don't want to do it. They're afraid to do it.
That's not true.
I will leave it at that, and Treasurer Wilton.
As the treasurer for the city of Rutland, I know we spend $3 million a year on health care just for the city employees. It doesn't even include the school. That's just the city. And year over year, our average increases for the last few years from Blue Cross Blue Shield have been 13%. Nobody knows better than me that we need reform. I want to put out a disclaimer right now. As an individual and as a professional, I'm not opposed to a single-payer plan. I'm not opposed to universal care and none of those kinds of concepts. But I'm a realist, and I work in numbers, and I know it has to work. I hit this model with everything that Shao proposed. Everything. This also assumes of the 621,000 Vermonters that 424,000 people are actually covered in Green Mountain Care. And that is because we have 105,000 people that are currently covered in self-funded plans. These are larger companies, usually multinationals like GE or IBM. Vermont State Colleges is another one, although it's not multinational, that have their own plan. They are covered under ERISA, which is a federal law. They're not in here as participants, even though they're paying the payroll tax. It also considers that anybody who's covered under Medicare, of which there are 78,000 Vermonters when you deduct those who are dual eligibles, Medicare, Medicaid, and also almost 14,000 Vermonters who are covered by military care, whether they're veterans or active military folks. So it assumes that those three groups are not included here for the purpose of the benefit, but if they're employed, they're paying in on the payroll tax. The base model, as you can see, the first year has a tremendous loss of $123 million. That's not $123,000, that's $123 million. Now, the legislature worked very hard this year to bridge a budget gap of over $100 million, and it wasn't easy. It was fraught with difficulty. Next year's budget will probably be even tougher because there's going to be that much more of a challenge. If the legislature had a hard time finding those savings, where will they find $123 million to fund a separate fund deficit? But even the second year, when the reserve is only being increased to match the increase in the experience and the increase in costs, even then, it won't cash flow and it doesn't break even. We don't expect it to make a profit. I totally understand that. But as you can look forward, the problem came very clear. And that is that any proposed system based on any kind of tax funding with anticipated cost increases in healthcare cannot work. And the reason is the proposed system has the same flaw as the current system. And that is simply that healthcare costs are growing at a faster rate than the economy. You've heard it a number of places. The Joint Fiscal Office of the legislature opined this in a letter to Representative Larson, who's the chair of the House Health Care Committee, in a letter, and I've got the essential quote on the back page. This was dated March 7th, and it says, quote, "The underlying costs versus revenue trends are likely to continue into the foreseeable future, as I indicated in my February 24th remarks. This trend raises a fundamental challenge to any public or private healthcare program. Proposals that lower base spending and/or ongoing cost growth may mitigate, but not necessarily alleviate this trend." Is if the self-funded plan participants, those 105,000 Vermonters, do not have to pay the payroll tax, we're looking at losses year over year of $400 million. But there is an option to that, and I've done the math, and that is that the payroll tax goes from a 14.5% combined employer-employee to about 21%, further exacerbating this issue about the economy. Or the value of the policy, you heard Senator Mullen talk about the actuarial value of the policy being, 70 to 80%, gets eroded to a 50 or 60% actuarial value. Now, if people are concerned about the quality of their health care and their access, and somewhere down the road, because of the cost, and the legislature can't fund it, we end up with a 50 to 60% plan compared to what people in Catamount have today at 80, somewhere close to that. What does that mean to us? And I think Senator Mullen's comments about the legislature creating a program but not being able to fund it adequately due to cost pressure is an accurate, discussion. It's an accurate portrayal of what happens in real politics. And so if that were to occur here with this program and there was no other cost support, you could see this happen. I'm disappointed that a town treasurer, that's what I am, I'm a town treasurer, with a little financial background, I have to admit, I've got some sophistication, was able to do the research part-time on my own and come up with a base model that is ties right to the administration's assumptions. And I was able to come up with this, and yet this was not discussed in the legislature. No model was presented to the legislators. I believe that some legislators asked for it, were not given it, saying you couldn't do it, it wasn't in the bill. You know what? There was enough information out there that I could do it. I really think someone had an obligation to do this and present it to Vermonters. And if nobody else wanted to,
a lot of us in the legislature, as Kevin said, had been asking for data. We were particularly concerned in looking for data when it kept being brought up that the minimum coverage in this plan would be that which is offered under Catamount. And it concerned a lot of us since at the beginning of session the governor had asked to do away with Catamount because it was bankrupt. If Green Mountain Care works and we can fix the healthcare system at a cost that we can afford, voters ought to know that before the next election. And this healthcare is next year's election issue for most people. You want to know what it is and how much it's going to cost. So Randy's proposal simply said, we're going to be discussing this in the campaign. Get the voters the data so that the voters have the information before they go to the ballot box. Get it in September rather than in January. And that was defeated, saying we can't possibly get all that information in time. Wendy's been doing this part-time. Dr. Shao did his entire report in 6 months. So it seems like we've probably got the data that folks could gather the information they need by January or by September of 2012, rather than have to wait till January of 2013.